podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Dr. Graham Taylor. At some point in all of our lives, we will experience loss, the most difficult loss being the loss of someone close to us. With this loss, the landscape of our life changes and the process of experiencing and working through our grief begins. Here today to share with us about the grief process in general and how to recognize complicated grief specifically is Dr. Kathy Shear. Kathy is a professor of psychiatry at the Columbia School of Social Work and Columbia College of Physicians and Surgeons. She's also the founder and director of the Center for Complicated Grief. She's been studying and treating people with complicated grief for more than 25 years. Kathy engages deeply in research, teaching, writing, and recently, her research contributed to the inclusion of this condition, now called prolonged grief disorder, into the forthcoming DSM-V. Kathy has developed and tested prolonged grief disorder therapy, a short-term strength-based intervention that helps foster adaptation to loss, and confirmed its efficacy in 3 large NIMH-funded studies. Kathy, it's so nice to have you here today. Welcome to our show.
Thanks so much, Graham. It's great to be here. Thanks
Great
for
to
having
have
me.
you.
Yeah.
Hey, we know that there are multiple losses or multiple types of losses that we can experience in our lives. It can be work-related, it can be friendships, it can be financial, etc. But the most difficult losses we experience are within our primary relationships, it seems. Why is the loss of a loved one such a difficult part of our lives?
Well, that's a great question. And, you really could flip it and say, why is falling in love with someone such a hugely important part of our lives?
That's good. That's a nice flip. Go off of that. Why is
So
it so important?
it's so important because we are biologically predisposed to seek, form, and maintain close relationships, close, intimate relationships with a small number of people in our lives. And those people play an incredibly important
Yeah.
role in so many ways.
Yeah. As I've listened to some of your writing or read some of your writings and listened to some of the things you've talked about how in being relational beings, this relationship provides a safe haven. There's security in that. It's a basis for our safety. You even talk about the importance of attachment theory in the relationship that we form. Say a little more about that part and some of the other aspects of being in a relationship that even at a psychological and biological level has some important function.
Well, right. I mean, these are relationships that anchor our lives, really. They're people who we turn to when things are not going so well, when we're stressed or threatened or whatever, and they're there for us, and they support us emotionally, they support us physically, they help us out problem solving and even instrumentally at times. And then when things are going well, and this is
Yeah.
really important because sometimes we don't think about this in attachment theory, but when we think about attachments, but when they are going well, these are the people who have confidence in us, who
Yeah.
encourage us to go out in the world and do things, and they also share in our successes. And that's called capitalization in the
Yeah.
psychology literature, actually. And it turns out to be really, really important. But
Yeah.
both things are important. And I want to say one other thing, which is we know how important people are when we stop to think about it. But actually, it turns out that they're also even more important than we think because they have impact on us kind of behind the scenes in our implicit brain, both
Yes.
physiologically and psychologically. So, it's hard to overestimate the importance of the people we love in our lives.
You've shared things as I've listened that we don't even take into consideration sometimes. Things like those relationships at that level of function impact our thinking. They help us regulate our emotion. They help us form our identity. It even impacts our immune systems, doesn't it?
Exactly. Yes.
Yeah. Yeah. I think one of the things I've experienced in some of my work around that is that it's really our foundation upon which everything is developed and built. And that gets shaken with loss, doesn't it? And it's really a stress response to that transition and that loss of that significant other.
Yes, absolutely. And so you mentioned two things. One is it's a stress response, and we know that the loss of someone close is one of the greatest stressors back in the, in the 1960s when they had that list of
Yeah,
of
the subjective units of
future
distress, the
shock or
SUD
something.
scale.
Yeah,
That's
yeah,
right. That's
yeah,
right.
yeah. It's right at the top. But also
Yeah.
you mentioned the fact that it changes the landscape of our life. It really loss of someone, when someone dies in particular, it affects us if we're close to them, but it also it really affects the whole world in a way. I mean, not the whole world, but a lot of
No.
people in the world. Yeah.
I
Yeah.
think that that's a great. I hadn't thought about that piece because there is a rippling effect. They talk about the butterfly effect. That there's a butterfly fluttering in Australia. It affects me here where I live, and that
Exactly.
that 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 kind of chain reaction, that rippling effect. Yes, it does. It affects all of us when someone passes. And I think one of the reasons I like to start out with this today, and I appreciate you kind of anchoring us in this, is that sometimes folks don't appreciate. We'll be talking about this in just a little bit here, but they don't appreciate that grief does rock our world. It does change our landscape. And it is something that, we don't really get much of an experience, or we don't have something to reflect upon personally until we actually go through it. So it can really be a very challenging process.
Right, and that actually that's also really important, is that we don't we don't really understand it until we go through it in a certain
Yeah.
way. We really don't. And so what that means too is that when we do go through it, it often throws us. We often feel like we don't know what's happening. And
Yeah.
then out of that, people will say, "Well, am I doing it right? What is this?" And so then they start to worry about it. And that's going to be one of the pathways into prolonging it, actually.
Well, let's talk about maybe some of the pathways that we can go down, maybe even a normal grief process. I've heard you share that the emergence of grief is a natural occurrence to the loss of a loved one. It's natural. And that grief, and I absolutely love this, and that grief is the form that love takes. How beautiful is that?
Yeah.
So when we lose someone, so share with us just this path, and maybe the path that has kind of a normal grief process to it. What does it tend to look like as we begin to grieve somebody, and kind of let's say a non-complicated or prolonged way? What's kind of a normal grief process that we go through?
Right. The first thing to say about that is that there are not any two grief processes that are the same. So grief is always unique to the relationship that was lost. So that means even your grief isn't going to be the same when you lose one person as when you lose another.
That's
And
right.
your grief is not going to be the same when you lose someone, that someone else who lost the same person is not going to grieve in the same way. But having said that, we wouldn't be talking today if there weren't some commonalities. And I think of them as being at like 30,000 feet, like
Yeah.
there's sort of the grouping factors or something. But in any case, what those are is that what we say is grief emerges naturally and finds a place in our life.
Yeah.
And so what we mean by that is that a meaningful loss and a grief response are inextricably tied. So you don't grieve without having a meaningful loss, and you don't have a meaningful loss without grieving. And so it will emerge naturally. And typically, when someone close dies, what it looks like is an attachment separation response. So what is that? That's proximity seeking. It's sadness, anxiety, it's big emotions. Proximity seeking meaning searching, yearning, longing, and just thinking a lot about the person. It
Yes.
just becomes center stage in your mind. And
Yeah.
then, of course, a lot of other big emotions and a lot of preoccupation with thoughts and memories of the person who died. And
Yeah.
along with that, a natural sort of turning inward and loss of sense of connection actually to the world for a while. There's a loss of sense of connection to other people, to anything that used to matter. The only thing that matters is this person, and that they're gone and you can't believe it and you want them back. And
Yeah.
that really tends to be, to come in waves kind of. And we alternate between doing that and almost like dissociating from it. So one way to say it is that you confront the pain and you set it aside.
Yeah.
Another way to say it is you are immersed in the pain and then you kind of block it out. you
Yeah.
can you can think of it in either way. And during that oscillation, most people will have a very strong sense of disbelief. It's hard to wrap your mind. It's not that you don't think the person died, but it's hard to wrap your mind around it. And
Absolutely.
yeah, And so that's a big part of it. And also almost everyone when they first learn of the death will have just it's almost like it sort of flows out of you to say no, no, I don't want them to be gone. It's wrong that they're gone. It's unfair that they're gone, something like that. But no, protest. And the other thing we do almost virtually every time something happens that we don't want to have happened, and this is a big one of those, is we automatically start counterfactual thinking, meaning imagining alternative scenarios. And sometimes those are worse scenarios, so we comfort ourselves a little. It could have been
Mhm.
worse, that, but it could have been some other way. It just will start to go in our minds.
Yeah.
And that's an adaptive process in some situations, but in
Yeah.
this one, you kind of have to like let go of that because it's going to come and you're going to have to say somehow you're going to have to let go of it. But most people do that. Most people will say,
Mhm.
if only the person hadn't crossed the street at that moment when the car hit them, why weren't they delayed, whatever. But then they will say, well, it would have been great, but that's not the way it happened and I
Mhm.
somehow have to figure it out.
Yeah. I really like that. You were saying something about the meaningfulness of loss. And if you've had a connection with somebody, there's going to be loss and we can celebrate that. I was working with a young lady one time who came in to see me and she said, Graham, I'm so conflicted because I just lost a parent, but I really didn't feel anything at the funeral. And she felt like somehow there was something wrong with her or she didn't love them in some way. And what we're able to do is frame it in what you're kind of suggesting here, that without that attachment, that parents bond, children attach, and without that bonding from the parents, that they never really formed a very close relationship. They were parent in title really only. And so you got to kind of right size that and kind of hold that loss, but without having so much guilt or kind of self-recrimination that she didn't feel like a human being, because you're supposed to miss somebody when you lose them, right? You're supposed to cry, you're supposed to mourn, and she missed the loss, but it wasn't as deep as maybe somebody else. On the flip side, I've had folks that just really really struggle, and I'm excited to get to your grief therapy process, because in some ways being able to grieve is such and to mourn and to just sometimes even ache is such a lucky thing for some, because that what that tells me is that if you're mourning and this loss means this much to you, then that attachment with that person, chances are, was pretty significant. And how lovely is that to say, hey, I miss them so much because we had such a loving connection together. And what I appreciate you kind of laying out here is some of the signs, but we know that of those grieving, you've shared that about 7 to 10% of them experience what's referred to now as prolonged grief. Shift for us a wee bit. What differentiates this prolonged bereavement process from normal grieving, and how does it seem to go deeper? And how can it become kind of what was referred to previously as complicated for the person?
Right. Well, thank you for that. And thank you for those examples. And you're so right that those are both totally natural responses, and we don't want to judge them. And
Yeah.
judging is one of the things, as I said, that will get in the way of the grieving process. So, what happens really is that some of these early defensive responses, actually, the what I was saying, the disbelief, the protest, the counterfactual thinking, self-blame, we call it caregiver self-blame because that's part
Mm.
of the relationship is taking care of the other person. It's not only they take care of you. And so naturally you feel some self-blame, almost everyone does. But if it gets a foothold or anger or the other things that are common are excessive avoidance of reminders of the loss, which trigger that intense grief feeling, and people will be kind of afraid of it, and so they really stay away from it. Some of that again is probably helpful in the beginning, but if you hold on to that avoidance also, that's can be very problematic.
So when you put it like that, what starts out as a defense mechanism to help us through those initial stages, and we don't necessarily want to remove those because it helps us kind of in bite-sized pieces or in manageable ways begin to kind of take in this loss and metabolize it more and more. But it's when it becomes kind of stuck or it gets a foothold, then the very things that took care of us and protected us become the impediments to moving through it and maybe coming back into life in a necessary way.
Exactly. And actually, Bowlby has a wonderful quote about exactly this, where he
Yeah.
says the difference between healthy and what he calls in pathological mourning is whether these kinds of defensive processes persist too long and or influence mental functioning too much if they
Yeah.
sort of dominate it completely. And that's what we
Yeah.
see. Yeah.
So that loss kind of eclipses things in life that we don't want it to be eclipsing. We carry it in ways that are interfering at times,
Well,
possibly.
yes, but that we do that naturally in the beginning. What I'm saying
Yes.
is these defensive parts of the grief response that we were just talking about, that too much avoidance, too much
Yes.
counterfactual thinking, if
Exactly.
those persist
Right.
or take up too much of the mourning space, so to
Yes.
speak.
Yeah.
Yeah.
That's good. We'll be right back after word from our sponsor.
Continuing education is both a requirement and a learning opportunity, but finding the right CE provider can be challenging. AATBS, a triad company, offers continuing education for psychologists, social workers, marriage and family therapists, counselors, and behavior analysts. CE courses are available both individually and as part of our new All Access Pass. All Access Pass provides a library of over 250 unique courses. That's more than 800 hours of CEs, with new courses being added every month. As a special offer, Behavioral Health Today listeners can save 15% on CE purchases. Visit us at aatbs.com/BHT and enter promo code BHT15 during checkout. That's aatbs.com/BHT. Check out our library and check off your CE requirements today.
So walk us through a little bit, even a little bit further. I know that there's some things that can derail our adaptation to this, some of the second guessing, or you're talking about the kind of the escaping reality, kind of the roller coaster of emotions. But continue to talk about what differentiates this prolonged grieving process.
Right, exactly. That's exactly. So basically you can think about it as that mainly what we have to do is adapt to a changed world, and
Yeah.
that change is partly our perception of the world, and that's sort of the internal part, but it's also really, like we were saying, a changed world. We have to adapt to it. And what that entails is, first of all, accepting the reality, which is painful. And, it means accepting the finality of the loss, the consequences of it, the permanence of grief, accepting it
Hmm.
into your life, and also the changed relationship that we have. We don't lose our relationships
Yeah.
because they're internalized mostly anyway. And then the other piece of it is to restore the capacity for well-being. So that's what moves grief along, is when we adapt in those two ways. And when we have things that get in the way of that, that's what you were talking about. And that is those defensive processes that become too persistent or too big. And they are exactly the kinds of things that you were mentioning a minute ago. And what
Yeah.
that does is we don't adapt. And so the grief stays intense and preoccupying and takes up too much of our life, like you said before. It just doesn't let anything else in.
You've shared before that we can have some pre-morbid vulnerabilities, those things that might exist in our life prior to coming into a significant loss. What are some of the things that someone might, maybe like a depression or other things that can really kind of compound that grief process? Say a word about that just real quick, would you? And maybe even the type of death that their loved one experienced. Weave that in
Exactly.
here for us, please.
Yes. So people who have a history of mood or anxiety disorders, or probably any mental disorder, just, probably deal with stress in general less well. And this is no exception. And maybe it's
Yeah.
even more so because this is so big. So that's one vulnerability. Also, early attachment
Yeah.
insecurities, especially in a context where the loss is someone with whom the person actually was able to have a positive, a secure attachment. That paradigm is what we mostly see, actually, in terms of personal vulnerabilities. But as you said, the type of loss, the way the loss happens, is also highly impactful. So any loss that is sudden and unexpected, and especially violent losses, suicide, homicide, accidents, natural disasters, COVID falls right into that. So
Yes.
we think about double or so the likelihood that someone will kind of get stuck in
Yes.
this process. And then also the context of the grief, basically, like who's around. We don't grieve well alone, generally
Yes.
speaking. We don't grieve well. It's not that we're always with other people, but we need supportive people around us to help us. And when we have none of that, when we really don't have it at all,
Yes.
or again, in the this is another thing about COVID that we've been, a lot of that help has been kind of denied us, or at least denied us in the usual way. So that's another risk factor.
Can you go one more lap for me around this idea, not just of the type of death, for example, traumatic, violent, But the kind of losses that we can experience that just happen out of the blue versus those that we might say with a chronic illness that we might see kind of coming, and the type of grief it is prolonged in its course.
Right.
So one that kind of comes out of the blue and just cold cocks us, and one that we see coming. Talk about the difference in the mourning there that you've seen.
Well, I would say the second type that you see coming is, it's more gradual. It's
Yes.
anticipate. You have that opportunity to kind of imagine what things are going to be like after this person is
Yeah.
gone,
The
or to
landscape is already changing in the process as
changing
it's
more
beginning to shift. Yeah,
gradually, yes. So we can gradually, a lot of people will kind of gradually adjust to that. Not everyone does, though. I mean, there's still, that's where you get that 7 to 10% rate anyway of prolonged grief disorder. But when it happens very suddenly, like you said, it's a shock in addition to the loss.
yeah,
And so it's especially hard to wrap your mind around it. And also it's especially easy to imagine in those situations, those alternative realities, so much so that some people who write about this say that it almost seems like there are alternative realities. Like you can like you're almost living those alternative realities.
yeah,
That's a natural thing to happen. So you got to get past, that's harder to get past.
yeah.
And the whole thing is much more intense.
One of the things you're doing really that I really appreciate is kind of normalizing this process. And you said a couple of times so far, one of the things that can really hinder the process or unnecessarily, impact it is this idea that we tend to judge these feelings. Like, I shouldn't be feeling this kind of feeling, or it shouldn't be this deep for so long. Can you say a little bit around the importance not to judge
Yeah.
your process of grieving, or let alone somebody else's?
Yeah, exactly. I think that, yes. And I think, it's interesting because our sort of very advanced, so to speak, Western culture is
Yeah.
one that really has left, loss and grief in the dust. And so we don't pay attention to it. We don't want to pay attention to it. We do provide, of course, some support. Generally speaking, people do have close people supporting them, but the world at large doesn't want to really know about it. And so we've kind of lost a lot of rituals that used to be
Yes.
done,
We
and
don't want to
all of that.
feel.
We don't, right? Yeah.
Yeah.
Nobody wants to think about death. Everyone, we're all oriented towards the positive, so to speak. And
Yeah.
death isn't seen as a positive, although I think in many ways, it is actually in the grand scheme of things. We wouldn't want everyone. I don't know if you know the book Tuck Everlasting. It's a children's book where,
It
you
goes
know,
on and
yeah, yeah. And I mean it's a nightmare, if we all live forever. I mean,
yeah.
you don't want to think about that. So, so there's not a larger world that creates a sort of holding environment. And and we don't anymore have the holding processes that kind of gradually move people along in grief, things that you would wear certain clothes, or, there a sort
Yes.
of culture of grief, you might call it. We don't have that anymore.
Just out of my own curiosity, do you have a sense of why we don't have those in the same way anymore? Why do we lose those? Because they were so helpful to
Yeah,
usher us through and kind of steward us through
right.
that grief that we're going to have to go through anyway. Why would we give those up, do you think?
I think that might be a whole different discussion. I don't know
Let's
if I
just
can
flag it
answer
then.
that. Yeah,
We'll flag it. I thought we can maybe have a
right.
quick 1 minute on that one. Maybe
Right,
not.
right.
That's okay. We'll
Do you,
flag and come back to it.
okay.
Rituals that maybe we even talk about at some point, having you back about rituals that we can go through on our own. I want to talk a little
Yes.
bit now,
Okay.
though, and
Okay.
shift about
Okay.
what you're doing. Death is permanent. I've heard you say that grief is permanent. It's kind of how we carry it.
Yes.
Share with us how you're using your therapy with folks to help them with their prolonged, persistent, pervasive grief, and what this short-term strength-based approach involves.
Yeah. So it really is actually pretty simple, Grandma. We developed a 16-session intervention, which kind of had its roots in both interpersonal psychotherapy, which has a grief focus, but which wasn't actually helping these people that much. But it's wonderful therapy, and it has a lot in it that is very good. And then we also conceptualize this as a trauma, which all death is really a trauma, right?
Yes, it is.
And so we brought in a lot from prolonged exposure treatments for PTSD. But what we do here is we work to help people move through what we found is 7 healing milestones. And then as we're doing that, we also look for these these kind of derailers, these defensive processes that are still, that are sort of persisting too long or influencing the person too much, that come up all the time when they think about the death. So the milestones include understanding and accepting grief, and we help people do that. And also the second one, managing emotions, both painful emotions, which of course are obviously big in grief, but also we have positive emotions in grief that sometimes people have trouble with too. So those two things, we help people with psychoeducation and with grief monitoring. So simple grief monitoring that they do for 5 minutes every day. It's really very simple. And then we start to work with people to help them start to imagine the future that could have some promise. And we do that using a technique that's derived from motivational interviewing, actually. We call it aspirational goals work. It's sort of long-term life goals. And we help people start to think about what they could be doing, that would be actually satisfying, give their life some purpose and meaning and possibilities for joy and satisfaction. Then we encourage them to bring someone in to actually the third session of the treatment so that we can help that person understand grief and loss the way that we've been talking about so far, and sort of, because often with people who have prolonged grief, those people are being they've gotten frustrated because they haven't been able to help the person enough, and they're sort of being a little rude and harsh. So we bring the person in and we start to help them reconnect and strengthen that relationship. And then we move to helping them narrate the story of the death, which is something that is really, really important because, the death is such a salient part of all of our lives, and they're not going to be able to think about the person without sometimes thinking about the death, maybe even a lot thinking about the death. So that we want to help people be able to think about the death. And similarly, to be able to live with reminders of the person who died, which can be very ubiquitous if this is an important person in your life, and also contain a lot of really, really wonderful memories often. And so if you have to avoid those things, then you're also keeping yourself away from some memories that you probably don't want to stay away from. And that's the last thing we do, is help people kind of bring those memories back, integrating them into the reality that the person is really gone. So people can almost always have those memories right from the beginning, but they tend to be in reverie states, in sort of dissociated, daydreamy kind of ways. We want them to be able to be a part of ongoing life. So we have some memories questionnaires, and then we invite the person to have an imaginal conversation with the person who died, which is a very, very, that telling the story of the death and this are the two very powerful parts of this, and also the most emotionally activating. But none of it is hard to do at all. I mean, any psychotherapist can do this.
So these are tools that we can use to, as clinicians, to you kind of setting us up here to be successful in this grief process with folks. I'm thinking that, as you're talking about it here, our tendency around loss is to lean away from it. You're encouraging folks and helping to facilitate them leaning into this loss. Even if I don't want to accept it, you're helping me learn that I can lean into it in a way that I can begin to accept it and tolerate some of the emotions that are naturally going to surface. And I love this idea that what if we still get to have that person in our lives, even if they're not present? And it sounds like part of the work kind of trickles down into, there's a way to carry this loss in a way that can still be very meaningful and have this person in your life that you carry with you, even in their absence. That sounds very important here.
It is important. I would say that I think it's beautiful what you just said. And I think it's almost exactly the way I see it, except for I do think that some people like having a sense of some kind of connection to the person, but they don't necessarily want them in their life all the time. And so people have different ways of carrying that person. And it doesn't have to be that they're really, front and center very often at all. But some people like it to be. So, and that's one other thing we do in this therapy, is we do a lot of active listening, which again, as therapists, we always do that. And so part of that is to look for those derailers, and to take, pause when we find them, when we hear one of them, and and give the person some space to reconsider that idea that if only something else should have happened, or why didn't I do this, or why didn't someone else do that?
Yeah, I want to jump into asking you about a case of someone that you were working with that was really, let's say, really stuck and struggling. But I want to name the derailers for folks listening into. You've talked about derailers for adaptation. It's someone just really protesting, saying no, so as not to have to feel the loss, or just really not wanting to believe it. Denial is a very underrated defense mechanism, but when it becomes inhibitive, then it becomes problematic. Or developing external circumstances that they focus on rather than having to focus on the loss, kind of getting busy, or kind of a manic defense, if you will, a distraction, or that survivor's guilt that you mentioned earlier on too, or even judging one's process. But those are key derailers that I think can indicate to us, hey, I might need some help around this. Or if we see somebody that we love kind of caught up by some of these derailers, maybe we might even make some suggestions.
Well, and two a couple that you didn't list just now that
Please,
maybe we want to highlight
please do.
also are the imagining alternative scenarios that
Yes.
sort of, if only this had happened some differently, and also the caregiver self-blame. That's another
Yeah.
big one. And then
Mhm.
the avoidance, the really avoiding reminders. And one of the interesting things about that is that almost always friends and family members encourage that avoidance, because one of the
I know.
things that bothers them is the emotional activation. It's hard to, we naturally want people to not feel bad. We want to comfort them when they feel bad. We want to help them, their emotions kind of. And so if someone, for example, doesn't, gets very activated going to a grocery store that they used to shop in for the person who died, that can happen. Then their friends will say, well, honey, you don't have to go to that grocery store. There's another one right down the street,
Right.
just go to the
Exactly.
other one.
Exactly. Well-meaning, but maybe not the best idea. Also,
Right.
you're also highlighting too, and this show is not going to be covering much about how to be a good listener, how to come
Yeah. Yeah.
aside somebody to be a support as a, family member, friend, et cetera, separate from a professional. But just what you're saying right there too, a lot of folks, and sometimes clinicians too, and each one of us as clinicians
Absolutely.
can be involved in this, is to listen to this pain and to watch the person in that pain. We say, well, we want to offer suggestions and kind of bring them up. But a lot of times, yeah, I want you to feel better. But also your loss is triggering for me as I listen and I watch you manifest this just heart-wrenching pain. It's hard for me to stay down there with you.
Yeah.
That's not an easy thing, is it?
That's right. It's not an easy thing. In fact, honestly, when I very first started this work, I was too afraid to sit in the room with a patient myself to do it. I
Yes.
had to supervise other therapists with, we did video supervision, so I got kind of exposure.
Begin to desensitize yourself over time, huh?
Yes, yes, I had to do that.
Hey, what a great recognition, though. I mean, I know, and I've said that before on other shows around this similar topic. There's this idea of vicarious trauma. Part of our work requires us to listen to and to sit with and to hold with our patients their stories of significant challenges or traumas, even including loss that they've gone through, that are very distressing and
Yeah,
painful
yeah,
and often unthinkable. And they can be profoundly sad. And it's, professionally, I've always said it's a big ask for us to sit there and join them in and sit down there until they can kind of come up and we can help them do that. But that's part of our therapeutic commitment. That's part of what we signed up for. And we're agreeing to as practitioners in order to help folks, like you're saying, work through these life experiences that are preventing them from experiencing the fullest possible life on the other side of this loss. That's
exactly.
why self-care is so important. But we also know that there's something like that when we call that vicarious trauma, there's also vicarious resilience,
Mhm.
where in working with trauma, we can also be transformed ourselves by a patient's resilience. And we can refer to this as, vicarious resilience. And it can have a positive effect on us as practitioner or even as family members as we watch someone go through this, as we bear witness to their resilience and what they develop. And it can change us personally, can't it, in our own lives? And
Absolutely.
we can draw
So,
inspiration.
and you're reminding me of one of my favorite stories in this work, which is
Tell
that
me.
one of the therapists that I was supervising was talking to a patient doing this, what we call aspirational goals work. And she said what we always say, if I could wave a magic wand and your grief was at a manageable level, what would you want for yourself in your life? And the patient actually stopped and thought a minute, and she looked at the therapist and she said, well, I don't know. She said, what would you want?
I love that.
And the therapist took it seriously, and it changed her life basically, because she went home, and it turned out that she had had a longstanding interest in photography, and she, as a teenager, she had been pretty active as a photographer, and she realized that she had a longstanding dream of photographing people in other cultures. And actually, we were in New York, so we have other cultures all over the place in New York. So she got out, I don't know whether she had it, she got a camera, she started going. I think first she went to Harlem, and she spent lots of time in Harlem. She produced a book. That was the first book on Broadway. She produced a photography book, and to this day, that was I would say about 15 years ago. To this day, she just went on a trip to Iceland, where a photography trip to Iceland, and sent me some of the pictures. Were unbelievable. But she's
all from that one moment.
All from that one moment.
It just triggered something for her.
Yeah. And, because but it was in a way a little bit vicarious resilience, because the patient also was starting to think that, but she directly shared with the therapist. But I think therapists probably start to think about this themselves too. When they ask that question, we naturally start thinking, what would I want? In this case, the therapist, the patient asked. But
well, you said earlier that, one of our existential, fears is the fear of death and control and all those things. And what we're kind of signing up for here is to lean into loss with people. And ideally that can be transformative. And that's, I'd love to hear, I know you've worked with a number of folks. I'd love to hear a story of someone you worked with that you just found that was just really anchored in their loss and just this prolonged grief that through your program, you saw her begin, or him, to transform out of. Can you share with us a story that kind of stands out to you?
Sure. And I just want to make one quick comment about this issue of what affects us. So, because it is definitely facing loss and death, but also the feeling of helplessness that we have about being able to help someone whose issue is that somebody died. It kind of intersects with what you said, but it really makes us have to face the fact that we all live under the shadow of death, right? And that we have to kind of find that pathway. We don't even want to think about it, but we have to find the pathway into life under an umbrella of death, because that's how we live, right?
That really is the other side of this, of the same coin. On the one hand, it's really hard to sit with somebody in that place of intense emotion, even ourselves. On the other side of that is our control a lot of times is so very limited, and we don't perceive it that way until we're confronted with it as a listener, someone going through it. And that's a hard place to sit too, recognizing that I may not have the control that I once thought I did.
Mm-hmm.
Yeah.
Yeah. And I don't want to face that.
And I don't want, come on. Yeah. And I don't want to face that. Exactly right. And that's an okay thing to name, but not stay stuck in. So walk us through a case that might stand out to you. That was really helpful.
So I'll tell you about a case that actually people can even go on our website and see more of this case, because it was a really nice example. And this is someone who had lost her 13-year-old son to cancer 4 years earlier. When I saw her 4 years after that loss, and she was in a place where, it was very dark. I mean, she had no idea that she could move forward in her life in any way, shape, or form. And she had been in a number of therapies with really excellent therapists, actually, this person. And they just were kind of stymied by all this also. And by the way, they were also suggesting to her that she not go to some of these places that were very triggering for her. Yeah. So, I mean, and I think that's a natural desire. So we walked through the therapy that I just described to you. And each time, like I still remember sitting with her. The first session is when at the end of the first session, we give someone this grief monitoring form, ask them to take 5 minutes at the end of each day and look back and find a time when the grief was at its highest level and rate that on a 0 to 10 scale, and then make a little note about what was happening and do the same thing with the lowest level. And, I explained this to her, and she just kind of stared at me, and she didn't say anything. And she said, okay. And she went home, and she started doing it because she really was in such a bad place. She didn't know what else to do. Honestly, that's a lot of the people we see are they only do what we ask them to because they don't know what else to do, and because they feel so desperate. they don't think it's a good idea. In other words,
Right.
they don't. So but she very quickly started thinking, this is really interesting. It was a more interesting thing than anything else she had done before. Then the next session, I would explain, this way of seeing grief, and that also was tremendously reassuring.
That's
And
good.
she really, she really found it interesting, but
Was
also
this changing her paradigm on the way that she was kind of locked into seeing it, and maybe introducing something kind of outside the way she saw it?
exactly,
That's beautiful.
exactly.
That's wonderful.
Yeah,
Tell me more about it.
yeah.
So it kind of unlocked something for her and kind of got her curious and leaning into it in ways that she'd been leaning away from it and avoiding.
Well, okay, it's interesting you say that, because actually it did get her very interested, especially the attachment theory. We kind of explain attachment theory, and I mean, most adults can understand it if you
Mhm.
explain it in normal terms and not too medical, but she didn't know anything about kind of the research side of what we really know about attachment relationships. She found it very fascinating. And it is, as you said earlier, also normalizing a lot of what she was experiencing, which was a big relief. But then, what we also do in that second session is kind of outline some of the things we were going to do in the therapy. And one of them, of course, is to address the avoidance. And when I explained that, she got really, really defensive. And she started to say, are you telling me that everything I've been saying, everything I've been doing, everyone's been telling me to take care of myself, and you're telling me I'm
Right.
supposed to go and do these things? Like,
You want me to do what?
right,
Right.
exactly, exactly. So I said, okay, wait a minute,
Let me back that
backpedal,
up.
right? But and then I said, tell me what you're feeling. And she started explaining a little, and really she was worried that she was kind of self-critical. A lot of people are,
That judging piece. Yeah.
yeah. And so when I clarified that I didn't think that everything she was doing up till now was wrong or bad or
Yeah.
anything, then she relaxed a little. And I said, I'm just taking a little bit different approach. And she ended, really after just about 3 minutes or 5 minutes, she of that kind of up goes the emotion, and then,
Yes.
backpedal. And then she said, well, I think that's really what I need. And so
That's
we were
so good.
back. So yeah.
That's
So
so
then,
good.
and
And where
then
did
we
you see her coming through? What was it looking like as she continued to
So
evolve?
then, yeah. And so then I want to tell you one other little story. When we did that first, we do this exercise where we ask people to close their eyes and visualize themselves back at the time when the person took their last breath, basically, or when they first learned of the death. And in this case, it was that she was right by her son's side when he took his last breath. And so she tells that story. And then after that, and it was very poignant, and and we asked people for their distress levels, and it went way up and everything. And part of that story was that she'd been afraid to touch him after he died. And so she didn't. And
Mhm.
so we kind of reflect together on things that she might have observed for about 10 minutes. After we do this exercise is 10 minutes, and then we kind of reflect on it. And in the reflection, I said, what did you notice when you were telling the story? And she said, well, I didn't kiss him goodbye. So I said, okay, I said, do you think you should have kissed him goodbye? And she said, yeah. And I said, is it something he would have wanted? And she said, yes. And so then I said, well, do you think you let him down? And that kind of stopped her,
Yeah.
because she said, I would never let him down. I didn't let
Oh,
him down. I never let him down. And so that was like a huge, she'd never said that before, and so I just want to say, we all have a tendency. This is one of the things we have a tendency, someone says something like that, and you want to say to them, oh, honey, but he'd already gone, he didn't know the difference. And don't beat yourself up like that. That's what I'm sure her friends, if she
yes,
told them, would
of
have,
course.
but by that's part of the therapy, is that you kind of like, you keep saying lean in. We lean into the problem too, right? We're leaning
Yeah.
into that problem. Okay, so it's a problem you didn't get. She's saying it's a problem, so I'm
Yeah.
saying it's a problem, and then
Yeah.
just getting her to talk about it. So that was a turning point, really. Even
But what I see in that is that she came to a larger understanding that of herself in relationship with him. She might have wished that she had kissed him goodbye
Yeah.
and he might have
Yeah.
liked it,
Right.
but it wasn't attributed to somehow her letting him down. And then now she goes to reclaim something about, no way did I ever
Yeah.
let him down. There's something, it sounds very therapeutic at
Yes.
another level of understanding that this relationship, I did a good job in.
Yeah.
Yeah,
Yeah. That's so
that's
well put.
awesome.
That's so well put and so insightful, really, Graham, because that's exactly what happened. Because when she first came in, when I very first met her, I remember her saying, I mean, she was really self-critical and said, she was not a good mother. And she really, she had let her son down over and over again. She was saying things like that. And this is only, I'm talking about the fourth session that
Wow.
that this happened in. Yeah.
That's exciting. As I said at the beginning of the show, this is an evidence-based approach. It's a strength-based, a short-term 16 weeks, seven points you say you're going through. And your work in this field of prolonged grief, once called complicated grief, prolonged grief is now included or going to be included in the forthcoming DSM-V. First of all, congratulations on that. That is huge. And
Right.
what a great legacy
Right.
to have in this process. Tell us about just going through yeah, your laughing is probably telling us a little bit about what that was like. Help us understand what
Well,
that was like to be
you're
included.
re-traumatizing me.
We have a program for that. Right. We can walk you through that.
I'll tell you, as a profession, we don't just take, every little thing that comes along that
No, we
maybe
don't.
someone thinks is a problem and say, okay, let's make it a
No.
diagnosis. That's not what happens. If you know something is really in need of
Yeah.
it and you're trying to get through a process that's very careful and very deliberate and very multi-leveled,
Yeah.
but it takes a long, long, long time.
There is
So
rigor in that, isn't there?
there's a lot of rigor in it.
Oh
There's a lot
my.
of rigor in it and a lot of eyes on it, which I think is so important, so
Yeah.
lots of different perspectives, including, I think of 3 or 4 or maybe even longer month time when the public, just the general public is commenting. And so anyone who wants to have input into this process gets it. And,
Yes.
from my side, that's traumatizing, but from the larger side, it's
That's
great.
terrific though. What a
Yeah.
great contribution. And I love the idea. Why did we change it from complicated to prolonged, by the way?
Well, complicated is kind of not, it's a very imprecise kind of word. And I think one of the big reasons was that it's used by different people in a lot of different ways. And so some people say complicated grief. For example, well, in IPT, for example, they use the term complicated grief to refer to bereavement related depression.
Yeah.
So that's a confusion. And then there were a group of grief researchers who argued that complicated grief was much more broad than
Yeah.
what we were talking about here. So I think it's a more descriptive term.
Yes.
And so in that sense, I mean, there's been disagreement about that all along. I think what really happened was the ICD-11, the World Health Organization, took the lead in this in a way because their ICD-11 they included prolonged grief disorder as a new diagnosis in that, and there was a lot of debate about whether to keep the term complicated grief or switch it
Yes.
to prolonged grief disorder. And they decided after a lot of debating, so you have to respect that, right?
Yes.
And then once that happened, then if we had in the DSM gone back to complicated, that would just have been more confusion, right?
Yeah.
So,
Totally get it. Let's keep it
yeah,
let's keep
yeah,
it linear and kind of keep
yeah,
it consistent in that.
yeah.
That's wonderful. Well, congratulations on that.
Thank you.
That's an exciting contribution to our work. Hey, we're kind of turning the corner here and coming into the close of our show. For those listening in, give us some ways to learn more about your work, things you might direct us to in terms of resources. We'd love to hear,
Sure.
please.
Yeah, so we have a website, which is right now www.complicatedgrief.columbia.edu. It's
Yeah.
one of these days, it's going to become very soon, probably when they announce, we finally decided when they announce this officially, which they haven't from the DSM, even though it is approved, it hasn't been announced. It's going to be in DSM-5 TR,
Okay.
and that should be out by the end of the year, I'm told. So we will change to prolonged grief
Got it.
columbia.edu. And on
Okay.
that website, we have all kinds of resources that you can download, watch, including the treatment manual, including the
It's terrific.
set of videos. Yeah. And we just finished another grant that if you're interested in learning this, we have a 10 module training tutorial that was developed by a company called Telepsychology, the Center
Okay.
for Telepsychology, and that will be available. We have workshops on a regular basis, and we're available. You can reach out to the center. We do supervision and consultation. We
That's
do a lot of
awesome.
different things. Yeah.
That's terrific. What a great contribution to clinicians as well and practitioners. Well, you've helped us understand that, the landscape in our lives does change following a loss, but there is, as you're talking about through your program and your work, there's life to be lived after this loss. And if we can grieve in productive and growth-oriented ways, we can find a path that can allow us to continue to grow and have joy in our lives while continuing to carry and relate to the one we've lost in a very meaningful way. So I sure appreciate you being on the show today and sharing with us what you've done and what your work gets to contribute to those parts of our lives that can be very, very, very difficult for us. Thank you for joining us.
And thank you for having me. Really, it's a
Been-
pleasure to talk to you.
It's been great to have you on. I also want to thank those of you listening in today. We appreciate you dropping by, and we will look forward to having you join us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Tribe Network, all rights reserved.